Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Good evening, everyone. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic Clinic in downtown Rochester, and Wednesday nights are Dr. Haddad nights. Dr. Jeff is a U of M grad dentist from U of M, but he's right here in Rochester Advanced Dentistry.
Dr. Haddad Nights. I love that. I like the way that sounds.
Haddad Nights in downtown Rochester.
That's great. It sounds like a lot more fun than it is, but I do appreciate the compliment.
It's kind of like Talladega Nights.
Yeah, right.
Dr. Haddad Nights we have, right?
I love it. This is great. Well, we're going to have a good time tonight, I guess.
Yes, it's going to be a good show, Jeff. I loved last show. The last couple of shows have been so good, and I'm really touched and honored to have you here because I know how sincere you are, and I see the excitement you are. You know, we were talking about actually tonsils and adenoids and obstructed airways, and it's not like, oh, come see you. And, you're saying we need to refer these people out.
Right.
So
I actually push business away.
Yeah,
actually, which
I
is
think
fine.
your heart is awesome. That it's you want to, number one, what's the cause of the problem? Number two, is it a dental issue, a problem you can have? If it's not, you want to refer them out because you have their best interest in mind. And I'm very touched and honored, really, to have you on.
I appreciate that. I've always believed that I don't need to be everybody's hero. I want to find the help that they need. And if it's me, great. If somebody can do a better job than me or a job that is outside of my realm of expertise,
scope of practice,
right? Then that's who they should see, So that's a big part of my philosophy, and at the end it all comes back to you. So
it does. I've refer so many people out.
I know
because
you do.
It's a problem. If you have a problem that's out of our scope of practice, and I'd like to tell all the young dentists and chiropractors and doctors, never be afraid out there to refer out, because you know what, it does come back to you. God honors that.
Absolutely.
And you refer somebody out, God blesses us. It's like, how do you grasp? It's better to give than to receive, huh? No, I want to get all you can all you get, and sit on the can.
Right.
That's the world's philosophy. Get all you can, can all you get, sit on the can. And what do you mean giving? Yeah, you give, God blesses. But anyways, boy, we're really getting off.
You're getting all fired up here.
Yes, but I am fired up.
You're forgetting your scripture here. Let's get back.
So we're going to start our show with a prayer, because, boy, I think I really need one.
We all need one.
So from Hebrews chapter 11, the faith of the ancients. Hebrew chapter 11, verse 1 is the whole chapter. I'm not going to read the whole thing, but I would encourage everybody to read this entire chapter. The faith of the ancients. Faith is the realization of what is hoped for and evidence of things not seen. If you read that passage before bed, go through your stretches and just meditate on that. Faith is the realization of what is hoped for and evidence of things not seen. Because of it, the ancients were well attested. By faith, we understand that the universe was ordered by the Word of God, so that what is visible came into being through the invisible. And then it goes on to tell about all the great prophets and people of the ancients, Moses, Abraham, what happened with their faith, and how that faith came to be, came through fruition. So anyways, with that said, so Dr. Jeff, we talked about Nancy. Boy, we've really talked a lot about
Nancy's got
dear Nancy. God bless her.
She's got a lot of mileage.
There was a lot of things going on with poor Nancy and how she came in with the TMJ, but because of that, you found the sleep apnea, and you were relating a revelation to me last show. I was very excited, and it's something that I, in my 27 years, never thought, that the grinding is to open the airways, that we have a closed airway.
Yeah.
I've never thought that until you brought that up to me last week. You know, that was just amazing. Because you always pick up stress. I know I'm cutting you off.
Oh,
I don't care.
you're fine.
Shut up. I'm talking now. This is.
Well,
all you have to do
are
is
on fire
be here.
tonight.
All you have
This
to
is
do
great.
is be here, Dr. Jeff.
Yes, sir. Yes, sir.
So it was the clenching, though. You know, I've always thought, stress. We're under stress. Because I've always heard, every dentist has told me, you know, why are we clenching more than we ever have before? It's really on the rise, isn't it?
It sure is.
Is it just because we're acknowledging it more, or is it really on the rise?
I think it's a little bit of both. I think, again, we touched on this last week about environmental issues, okay?
Environmental.
And airway issues. I mean,
airway issues.
We have allergies in the world, the different processed foods, and just our environment. It's unfortunate.
The water, the air.
Everything. You know, we have
cell phones, you know, all that. You know, plastics.
There's a lot of things going against us. And
there is.
If our airways are, I mean, listen, to answer your question, yes, there's more knowledge, and we are identifying things more. I equate it to the autism, you know, dilemma of, you know, is autism on the rise, or do we now just know how to identify it? Well, I don't know the answer to that. But when it comes to this stuff, it's a little bit of both. We are seeing more because we know what to look for, but there is more because of our environment and because of the way that we're eating, and unfortunately, the way that a lot of people take care of themselves. So,
and you got to relate stress to some of it. But most of the dentists have always told me, there's more stress, so we're 80% of us are grinding now, or just a high amount of us have this bruxism, they call it, the clenching.
Right.
But no one has ever told me that it's in order to open the airway. That was a revelation to me last week when you brought that up. You're the only person I know, only dentist, who's ever told me that.
This is where my education lies. It's from a neuromuscular approach. We are taught that there's a few reasons why we grind. And don't get me wrong, stress is a factor. Believe me, I get stressed just like the rest of them, okay? And I grind. But what a lot of people misunderstand is that, I was stressed out then, I was grinding then, I don't grind now. I'm going to tell you, I've yet to meet the person who's just stopped grinding. They may grind less. Their significant other may not hear them grinding, but they're still doing a subtle clench grind that's not making noise. And then their times of stress or times of unrest, they are grinding a lot more. But the two reasons I see it is airway issues, or if your teeth or bite are in a situation that the muscles of your face don't like, and there's a battle going on. There's this struggle of the muscles wanting your jaw to be one place, but your teeth are fighting it, and the teeth are winning. Okay, the teeth win. Three things that dominate your bite, that make up your bite, and that's your teeth, the joints, your TMJ joints, your temporomandibular joints, which you connect right at the
jaw
ear
joint
there.
At the ears.
Correct. Right? And the muscles of your face. Your teeth dominate that situation. The other two accommodate. And unfortunately, they accommodate at a price a lot of times. Pain, tension, ear issues, which we'll touch on tonight a little bit because it's amazing the ear congestion and the ear ringing and vertigo or dizziness and how that plays a part in so many TMJ disorders and a lot of cervical disorders that you deal with on a daily basis. So this is really all goes hand in hand, and I just really want to, when I look at somebody and I see a bad bite, if I see a bite problem or a joint problem or something like that, the next thing I look at is an airway problem, because these people are truly, they overlap more and more, and they're just finding the similarities between a person that suffers from sleep apnea or snoring. almost hand in hand has the headaches, the tension headaches, the jaw pain, some of the ear issues. So we need to address these things.
That's a lot of issues that you're talking about.
And Nancy was a perfect example of that because we took care of her facial pain. We took care of her headaches, and she was feeling great. But I'm looking at her posture, which is that classic forward head posture. And if for those of you who can listen to my voice and imagine, stretching out your neck forward, okay, and trying to open up your airway, and then trying to look down so that you can actually see straight. That's that forward head posture. And, not to pick on the grandmas and the grandpas of the world, but you think about these older individuals who have a bite problem where they have the dentures, they lost their teeth years and years and years ago, and we have a situation that their nose and their jaws are starting to get closer and closer and closer together because they're losing that what's called vertical dimension. And those grandmas and grandpas, we watch out for them, but we want to stop our adults from becoming those people. And airway is a big thing, and destroying your bite, grinding, as things get shorter and shorter. Not only does the bite get collapsed,
so you're saying the teeth height, or what is getting shorter?
The teeth,
Doc.
The teeth. Yeah, that's correct. Okay. The teeth height and the bite, both. Okay. Your teeth start to shorten because of the grinding, which makes your entire bite shorter. And what's starting to touch? Your nose and your chin. Well, when that happens, what happens? Your airway closes.
I shouldn't laugh.
I mean, this is. I'm not going to let you get to that point, Joe.
I like your facial. If you guys could see his facial expressions here, it's terrible. I can't look at you.
Are you saying I have a face for radio? I know you're thinking that. That's the oldest joke in the book.
Yeah.
But no, this forward head posture is a problem, and I'll tell you, neck issues, neck pain. I see so much of this with my sleep apnea patients, and then we make this appliance for them, and we open up that airway, and all of a sudden, they don't walk like that as much anymore because they're breathing at night.
They're breathing.
But
yes,
sometimes that's not enough at night, and I need your help to straighten them out. But I'm going to tell you, if you are fighting with an airway issue, you're going to lose. I'm going to lose. This is like the elephant in the room with professionals like yourself and mine, where we're trying to do what we know. I'm trying to stabilize the jaw and make it into a good posture. You're trying to stabilize the cervical spine and getting them in good posture. And then right as they leave our office, they're just fighting to breathe again, and everything we've done is just thrown out the door. So, again, we touched on this last week. I'm a big believer of addressing that airway, and I can't do that. I need my ENT to do it, whether it be removing tonsils and adenoids, whether it be doing even a different type of surgery. Sometimes they'll even open up that airway a little bit,
Well, they put the wedge into the palate.
There's lots of things that, again, some is a little aggressive than others, and I don't like it. But if it's gonna open up a person's airway, if my appliance isn't able to do it, or if their airway or an obstruction is preventing me from doing my job, and I would assume for you too,
sure,
I need that to be addressed. And whatever it takes, I need to get that person breathing and getting them sleeping.
That is paramount. Like you said, the elephant in the room. So that's what we do. Sometimes we're able to adjust not only the neck, but sometimes it's the lower thoracics, that is throwing their head forward, which can, now that, so many of our patients that we treat will say, boy, I feel like I have so much more energy. And really, you know what that is?
Yeah, oxygen.
Yep, they're breathing more. And then hopefully if I can't do it, then, we go to see you with the dentist, with the TMJ, to see if you can open it up like you were able to with Nancy. And if at that point then you can't, then unfortunately, as a last resort, then you do the surgical procedure. But it's nice to exhaust all the non-aggressive, non-invasive procedures first, right?
I couldn't agree more.
But so here's the whole thing is like, what came first, the chicken or the egg?
Yeah.
Did stress, tension cause the anterior scalenes, the muscles in the front of your neck, to get tight, causing the TMJ? Or, like you said, is it the airway obstruction because of environmental toxins, water, the air we breathe, all the processed foods, all the things we're getting in our foods, and the way we farm, fertilize? We're being bombarded with so many things you don't even realize. causing your tonsils and adenoids and your glands in your throat to, and then obesity, gaining weight, right?
Yeah.
All
because of the foods again.
Closing down the airway.
Right.
So we have to deal with, so that's where regular fasting, I mean, we're still in Lent right now, and that's the heat of what we're talking about now is you need to fast twice a year. In the fall, you really need to do the gallbladder liver cleanse. And then for Lent, I'm a big fan of doing the juice fasting and then do 3 days of fasting right before Easter so that you can, cleanse the body, cleanse all. And hopefully maybe this will shrink some of the tissues along with ginger, turmeric, peppermint, the healthy chocolate. There's so many great things in the arsenal to shrink.
Well, and then you can enjoy Easter dinner without feeling guilty. I mean, I like where you're going with this. We gotta balance our calories. No, I'll tell you I couldn't agree with you more. I really think that this syndrome or this really epidemic.
It's an epidemic.
It is a problem, and I think I've mentioned it's been a long time, but I treat my own physician for sleep apnea. Okay, he was wearing the CPAP, which is the machine that positively blows air into your body, which the compliance rate is only 30%, and
30% compliance.
It's a shame because it is the standard of care, and it works. But it's very difficult. I mean, not many people want to be hooked up to a machine. And my physician was that same person, and he knew that I made these appliances. He said, you know what? I know I need to lose weight. Just like this is what made me think of this. You're talking about obesity. He was not an obese man, but he definitely could lose a little weight. He said, you know what? I'm going to lose some weight, and I'm going to try your appliance. And he did. And he stopped using his CPAP, and his sleep apnea stopped. And he owned his problem. He was determined and committed to change his diet and lose the weight. I did what I know how to do, and I made him this customized sleep apnea appliance, and now he's not using the machine. He feels great. The energy level, this is what I hear from all my sleep apnea patients. Energy level. I feel like I was in this mental fog before,
Sure.
It's an amazing thing.
Oxygen.
Back to the kids we talked about last week. These kids are not only are they dying, they can't hear. Their attention is completely not there because they're overtired, they're fatigued, they're not getting down to their good rest.
Fog.
Absolutely.
So now what? Now we're going to give them drugs,
right?
ADD medication,
Ritalin, exactly. That's
Ritalin.
Just throw patches on people.
Right.
It's terrible.
Yeah, that's really a downward spiral. And what are we teaching our kids? You got a problem, take drugs. And the parents going, of course, the teachers, the schools, from what I hear, understand they get kickbacks for putting the kids on it from the drug companies.
Come on.
They get kickbacks, yes. They are stimulated to do this.
Really?
That's my understanding.
Oh, that's terrible.
Okay. And I've heard that from some really reliable sources.
Oh.
However, what you can't do is add to the problem, because now we're teaching our kids, hey, you have a problem, take drugs.
Right. And we know where that can lead.
So there's an alternative. Is it you're not getting oxygen at night because of the swollen tonsils, or your jaw or your bite?
Mm-hmm.
So you really need to get your kids to a dentist who understands the airway opening, because oxygen is so vital. Now, here's another thing, Doc. I'd like to talk to you were talking about the forward head posture, right? So when your airway is blocked, you said you're leaning your head forward.
Mm-hmm.
Right, to open up your
right.
Now, so how do you know what came first? In chiropractic, what we deal with, people using too many pillows or sitting too much, and as you see so many elderly people, 80, the 80-year-olds, the classic with the walker, and they're all hunched over and they're trying to look up.
Right.
And a lot of it comes from even the thoracics.
No, that makes sense.
I mean, that's something to look into. Is it their thoracics? Is it their lower thoracics doing that? Causing some of their head, the hyperkyphosis of the thoracic spine that's locked up, and that doesn't allow them. That's throwing their head. Now, your head's the weight of a bowling ball.
Right. Correct.
Now, if you hold a bowling ball close to you, It's easy to hold it, right? Now, you hold that bowling ball out away from your body, man.
A lot heavier.
It's a lot heavier. Just the fulcrum, the lever. It's like a crane.
Yeah.
Right? You got a crane, and there's a big ball on top of it. And the more that, if the crane is upright, it's easy, but as it starts leaning on an angle, a 45-degree angle, the weight at the top is pulling it over. So that can cause TMJ, jaw tighten, neck muscles,
analogy I use a lot, and it really completely supports what you're saying, is I'll tell people, all right, what if you had one leg shorter than the other, a true functional short leg? Well, you're going to walk funny for a while, and then all of a sudden, you're going to walk normal because you accommodate and your hip has shifted.
It feels normal.
Feels normal, right?
Right.
And then they're walking, and all of a sudden they start having a hip problem 10 years down the line. Why did this all happen all of a sudden? Well, it didn't. I mean, this started a long time ago, and you've been accommodating, and you've got pushed over the edge. Well, if you've got a functional short leg, and I have treated many patients like this, by the time they're accommodating, now their hips are off, then their shoulder girdle, then their cervical, then their jaw. And I mean, it's...
So now you have this compensation up, and it could be from the way their heel is worn out on one side.
They could have one foot that's just misformed in some way, and it is causing all these issues. And now I've got to deal with what I would call an ascending issue, but I'm at the top block. I'm the top block guy, okay?
Sure.
And I got to deal with that jaw, and I got to do what I need to do. And again, comes back to, working with great professionals like yourself, and I do what I know how to do. But where did it start? I want to nip this in the bud, but we don't know how this began. We got to deal with it, but we got to address that root cause, or we're just putting band-aids on things.
Exactly right.
It's
sometimes it can be so complex it seems. That's where we like to rely on the Holy Spirit to give us some discernment, to cut to the chase, to have that. When you really love and care about your patients, sometimes you just have this intuitiveness to check their shoes and their heel wear or whatever, to see if it's coming from your foot, your low back, your mid back. Where's the problem come? Like you said, you're the top block guy.
Yeah, but that said, I know there's a lot of other pieces of this puzzle, and and I appreciate the comments you've given me on the fact that I don't need to be the guy that fixes you, okay? I just want you. I want to help you. I want to either help you myself or find the help that you're looking for, because it's not. I want to be successful. I had a patient who came in yesterday, and she had a lot of pain issues and very skeptical because, again, kind of the last guy on the list sometimes people find.
Sure.
And they've been told other things by other people.
Discouraged, maybe.
Of course.
Right.
And I feel the same way. And I said, listen, I'm not going to go down this road with you unless I'm going to be successful, because I don't like to fail, all right? You know me. I want to win, and I want to make sure that you're going to win with me. And if you're not a candidate for this type of treatment, whether it be us addressing your migraines or your tension headaches or your TMJ pain or your sleep apnea, if you're not a candidate for the treatment that I have to offer, I'm going to tell you. And if I know that you're a candidate for something else that maybe Dr. Joe could recommend, or another physician or professional that I know in my community, because I have great relationships, I've gone out and sought out the right people, in my opinion, for these different modalities, I'm going to get you to them, because I just want my patients' interests to be first. That's the main priority. It's got to be. That's the only way that we all win, is if we as doctors are doing the right thing and telling our patients. And listen, a lot of times I'll give my patients all the information. I believe it's the right thing, and I think in my heart I know it's the right thing, and they don't do it, and that's okay. That's their choice.
Sure.
But I'm at least going to give them the information to make that decision.
Make the decision. I think as physicians, we owe it to our patients, not only, as you said, to be well educated and take the seminars and be cutting edge and be eclectic with the whole thing, what we call multidisciplinary, where you work with a dentist, a chiropractor, ENT, physical therapy. But also it's our job to know the best physicians around.
Right.
So that we can make the proper referrals. That treat each patient like they were your mom or your cousin or your dad or brother or sister? Who, if it was you, who would you, do unto
And I
others?
have a very big family, so a lot of my patients are those people. I use that line all the time because it's not a line, it's a truth. My patients have become my friends over the years, and so I do treat them like my family and my friends, and it's a very important thing. And you made me think of something too when we talk about educating. We just started revamping our website, Dr. Joe, and you know how much I get excited about that.
I've got to take a look at it.
But if any of you, is anybody out there, some of the stuff that we're talking about sparking some intrigue or anything like that, whether it be migraines, TMJ problems, neck issues, any type of breathing, sleep apnea, please feel free to go to RochesterAdvancedDentistry.com. You can always call our office at 248-656-2020. Or, again, we love Dr. Joe's site, too. We're part of that, and we're constantly trying to add content to that, too, which is SimpleTruthsForHealthyLiving.com. A lot of information out there, and we're, we can only...
Yeah, so on there is a link right to your website, too.
Correct.
So to look at that. So that's a great thing. If I could get back to the forward head tilting, because that's being a chiropractor. That's what we
your baby.
Deal with, and we give exercises and stretches, try to mobilize the thoracics, the neck to do that, right? But can you imagine what happens now? Like you said, you have like our patient Nancy. You said had the classic forward head tilt, and then you need to look up so that your eye, because when you're the forward head tilt, you're really looking down.
Correct.
Right? So now to look straight ahead is as if you're looking up. When you think of the skull, you have the brain, and out the spinal cord comes out the hole called the foramen magnum, right? So now it's on an angle all the time. It's always being stretched. Right?
Yeah.
That's pressure. You have 50 trillion wires hanging down from your brain, your spinal cord. 50 trillion. Every cell in your body is hooked up to the brain. There's communication. There's wires, right? Neurons. So now it's always under tension and stress. That's going to decrease energy all the way throughout your whole body. You're having resistance. It's like a dimmer switch electrically. So now what you're going to do, like what you did with Nancy, to get that head tilt back. I mean, you did it in basically one treatment pretty much within a week.
I mean, and far from perfection, but you're right. We corrected her posture by supporting her mandible. Your lower jaw is held in by muscles. You make a couple cuts, your lower jaw is hitting the floor.
Hits the floor.
It's not connected, and people don't realize that. So if the muscles are unhappy, if the muscles are torqued, if the muscles are in tension, we're going to have issues. But when I support that jaw and the body doesn't have to fight to keep it in that position, because that's really what we're talking about. Your body, you talk about wasted energy and dimmer switch. Think about how hard it is going through life, struggling to keep, say, your jaw or your hip or anything in a position voluntarily that you truly have to think about, or your body has to think about tension and keeping that body, as opposed to just going through life and your body working the way it should, right? I mean, I make the analogy of when you go for a run. Somebody who has a bad knee. You put a knee brace on, you're going to feel good. You don't wear the knee brace, it doesn't feel good. And unfortunately, some of us need that as we get older, right? Mm-hmm. Well, it's the same thing with your jaw. It's the same thing with a lot of parts in your body. Unless you have the support to keep your body in working order, the proper fashion, proper
support,
functioning, system, then you're going to be fighting it. Your body's going to fight it, and you're going to be exhausting a lot of energy unknowingly, and really not even getting the proper output. So your body's not working efficiently, and a lot of times it's working inefficiently and in pain. Muscular pain, whether it be the head, neck, jaw, hips, whatever, it doesn't matter. The point is there's an issue, and you can't accommodate forever. and you'll try, and you see it and I see it in patients every single day. And I have patients come in, they're like, this just happened all of a sudden, and I just started getting these headaches. I look at them, and their mouth, I mean, their bite is completely worn down and collapsed. They have every red flag I could think of as far as a TMJ disorder. And I say, listen, I know you're feeling the pain now, and I know these
symptomatically it came.
I know these symptoms just came out of nowhere, but this has been going on for 20 years.
Long time coming.
Yeah, and so again, and I know you deal with that even more than I do, because at least I feel like even the worst dental patients in the world, they make it in for their emergencies, but usually the majority of your patients probably make it in for their back emergencies, right? I mean,
that's right.
And so
that's what we try to educate them.
It's an upward battle.
But as you were saying, 95% of the people who go to a medical doctor or chiropractor for back pain, it's unknown causes.
Right.
Doc, I was perfectly fine. I bent down to time. I don't know what happened.
Right.
It's unknown because, like what you said, it was a long time coming. And it's not how feeble we are sometimes. It's how resistant. And it's this compensating, like you were saying. It compensates for years but finally the body cries out, and it's the straw that breaks the camel's back. The key is,
no pun intended there.
Yes, the key is to treat it before that happens, preventive,
right?
Preemptive,
proactive.
Be proactive and have your teeth, your jaw. So when you see Dr. Jeff, he's not only going to check for cavities, for amalgam fillings, which I don't get me started, buddy.
Oh no, he despises them people.
For the mercury amalgam, but also to have your airways checked, the TMJ, the muscles, the forward head tilt.
Yeah, I think that really, any physician, any doctor, any dentist, chiropractor, whatever, you have to be thorough. And, I take a look at everybody the same way. I mean, what would be a great topic in the future too? I mean, some oral cancers. We do a complete oral cancer check at every single one of our hygiene visits. And I mean, it's a very important thing.
And that's something that there's no symptoms, really.
No,
right?
Very, very, very rare.
Until it's too late. Until it's too late.
And they've got some technology out there that we can even talk about that helps us diagnose these and identify things before they become a problem, So, no, I appreciate what you're saying. I really like to